So students, welcome to this lecture, and this lecture is about making decision about what current should be used for stimulation, right? So now the basic problem we face over here is when the patient comes to you, how are you going to decide what type of current are you going to use for stimulation, right? So we'll start it this way, that for example, a patient has come to you, right? And before starting the treatment, what all you are going to do? Number one, you are going to take the subjective data of the patient, right? And demographics. So subjective data and demographics means the name, age, the address of the patient, which area he is from, contact number of the patient for your records. Then there can be the other things which are specifically related to the condition that the patient is presenting. For example, if he says that he sustained a stroke, or he sustained an accident, or he sustained whatever, so chief complaint has to be noted over here, right? Then you go for his history, right? So we go for medical records. If the patient is referred to you, then he might be having a medical record of whatever he is presenting. So he might be having a file, or he might be having investigations, he might be having certain prescriptions from doctors, he might be having certain medications that are going on. So all those things have to be considered and seen, so that you know that since how long the patient is suffering with the condition, and in which stage he would have approached you, or he would have been referred to you for treatment. So this is second thing that is very important as far as the treatment, starting the treatment is related. Now supposing if the patient is presenting with anything, he is presenting with stroke, or he is presenting with spasticity, or he is presenting with peripheral nerve injury, you have to find out what is the level of response that the patient is showing. So for the level of response, the initial thing we are going to do, if it is a case of peripheral nerve injury, before starting and he has been referred to you for electrical stimulation, the first thing we are going to do is we are going to do the FG test, and also known as reaction of degeneration. Now, what is Faraday Galvanic test or reaction of degeneration? Faraday Galvanic test is finding out that which current the patient is responding the best. Already in basics we have learned that Faraday is a low duration current, right? So it will be helpful in stimulating the nerves, and Galvanic is a long duration current, so it will be helpful in stimulating muscles. So you will go for identification of motor point in the patient. Then we are going to stimulate it with the use of Faraday current, right? If the muscles start responding with Faraday current, okay? If the muscle responds with Faraday current, that means the muscle is innervated, right? Because if the motor end plate is intact, if the motor end plate is working, that means that the neuromuscular junction is okay, and the muscle and the nerve connection is okay. So it is responding with this muscle and nerve connection. That is first thing you have to identify, right? If the patient is not responding with Faraday, then we will go to stimulate with Galvanic, right? And if the patient is responding with Galvanic, that means that the muscle properties are retained, and the muscle properties are intact. The muscle is working properly, but the nerve supply to the muscle is not intact. So the first thing we do as the patient enters is we are going to explain the patient about the treatment, and we have to find out our parameter for where we are going to start the treatment. And for us to decide where we are going to start with the treatment, with the factor in mind that what is the history of the disease and what is the presentation of the patient. So the first thing we are going to do in nerve injuries is we are going to go for FG test. That will give you an baseline of starting the treatment. So if the patient is responding to Faraday sluggish response or brisk response, then that means that the neuromuscular junction and the nerve motor unit is intact. So the connection between the nerve and muscle is intact. So that means the nerve is okay. Either it has regenerated, it is regenerating, or whatever, right? And then you can continue with that. And if it is not responding to Faraday, if there is a spread of current, so what do you mean by spread of current? That you are stimulating on the extensor aspect, or the agonist is extensor. Here you are stimulating, but rather than response from this extensor response, we are getting a flexor response. So if this is there, that means it is a spreading of current, right? That means that the neuromuscular junction is not active. In that case, we are going to go for galvanic stimulation over the muscle belly rather than over the whole part. So first step we are going to do is that is known as FG test or reaction of degeneration. That is known as reaction of degeneration. Okay, so that is what we are going to start with. Once you get to know that whether the patient is responding to Faraday current or galvanic current, right? So if the patient is responding to galvanic, that means muscle is intact, and if it is responding to ferric, that means the NMJ and motor unit is intact. Fine. So now what next? Next we are going to quantify this particular response, right? So we have to identify that whether the muscle is innervated, denervated, or partially innervated, right? What do we mean by innervated? We mean by innervated is that the muscle is innervated, but because of immobilization, there was no movement in the muscle. So there is loss of properties of muscle. So there is a wasting and atrophy of muscle, which is reducing the activity of muscle, right? Do you understand this? We have read this previously also. So I'll just brief it up. That innervated muscle means that it can be because of atrophy or wasting of the muscle, that the property of muscle has gone down, but the neuromuscular junction and nerve to the muscle is absolutely intact, right? So in this case, there we have to find out whether it is this, right? Or second case, that whether it is denervated, that the nerve to the muscle is completely severed, or it has been bruised or stretched, or something has been done so that it is not supplying the muscle itself, or whether partial innervated, that means that the nerve was injured and now it is in a way of rehabilitation. So to find this out, we use a technique that we call it as the strength duration curve, right? So now once we have found out whether the muscle is responding or whether it is Faradic or galvanic, now we are going to find out the strength duration curve. So the curve is strength duration curve, right? Now what is this strength duration curve? Strength duration curve is we stimulate the muscle with the use of particular current with a particular strength and width of electrical stimulus, and we try to find out at what intensity the muscle is responding. Once we find out that with a certain duration of current, what is the intensity with which the muscle is responding. So let us just see that the duration of galvanic current by default that is used is it starts from 300 milliseconds, then 100, then 30, then 10, then 3, then 1, and then 0.01 and 0.03. Now this is the duration, right? Pulse duration that is fixed in machines of strength duration curve. We call it as a diagnostic stimulator, right? Diagnostic stimulators often have this pulse durations in intermittent galvanic so that you can record the amount of current flow that is present. Now here is the intensity, right? So 10, 20, 30, 40, 50, 60, 70, right? Now what happens is with the broader duration, when you start stimulating the nerve, it responds at a very low intensity, and as the duration goes down, the intensity tends to raise, because the longer the duration of current, that means the current is passed to the muscle for a longer time, right? So it needs lower intensity, because the more the current goes inside, it can break the threshold, right? As the duration of current reduces, the amount of current needed to stimulate the threshold tends to increase. So this particular curve is known as a SD curve or normal SD curve, which starts from the right hand and move towards the left hand. Fine. If a muscle is denervated, right? If the muscle is denervated, even at longer durations, it will not respond to the lower intensities. So here it will start over here, and there will be a steep rise in the intensities. This means that even at longer duration of current also, the muscle is not responding on lower intensities. So the intensities rise and the curve shifts to right. Okay. So if there is a shift of curve towards the right, this shows denervation. Now once again, let me tell you that this is the normal graph with broader pulse durations. The intensity of current required to stimulate is low, right? So as the pulse duration becomes shorter and shorter, the intensity of current that is required to create the action tends to increase, right? And this increase in the intensity is a graphical, and it is a slow rise. It is not a sudden rise. If the muscle is denervated, then in spite of a broader duration of current, as you tend to reduce the intensity, the muscle is not responding. So as you reduce the duration, the muscle is not responding. So you need higher intensities. So the curve shifts towards the right, right? The curve shifts towards the right, and this is known as the denervated curve. Okay, so this is one picture, that is the denervation. Fine. Now there is another picture where up to a certain level you get the normal graph. Okay, and then there is a sudden rise. Okay, so this we call it as a kink. Okay, what is the presence of kink? The kink shows partial innervation, right? So the kink shows partial innervation. So what happens is, at longer durations, up to a certain extent, it is responding parallel to the normal graph. But after a certain point of time, for example, if we go on 30 pulse duration, it is responding normal. After 30, there is a steep rise in the intensity. So that means that these many fibers are normal and these fibers are not responding. That means the muscle is partially innervated. and if the muscle is completely innervated, then we get the normal curvature that you can see over here. So as the curve shifts toward left, it shows the innervation. Okay, this particular curve that I have showed here is known as the strength duration curve. The strength of contraction based on the intensity required for stimulation on broader durations and moving towards the shorter durations. So after receiving the patient, we have done the Faradic galvanic test, and after the Faradic galvanic test, what we have done is we have gone for taking the strength duration curve. Now certain things you have to remember when we talk about the strength duration curve, right? Number 1, start with longest duration. Start with the longest duration, that is 300 millisecond, that is available on the stimulator, so that the current is comfortable and the intensities used are low. This helps the patient to get accustomed with the electrical stimulation and the type of current that is given to the patient. So first thing is start with the longest duration. Second thing is stimulate one long and one short muscle below the point of injury. Now for example, the patient is presented with an injury somewhere over here. Either he has sustained a fracture in the elbow, or he has sustained some sort of trauma or lacerated or open wound over here, and then the patient is presenting with a wrist drop. Okay, so you have to find out that whether the nerve is injured over here, it is injured on the above, or whether it is injured in the lower portion. So in this, which nerve is involved when we talk about wrist drop? It is the radial nerve. So we have to stimulate one longer muscle, one muscle above the point of this. Then we will stimulate one long muscle right from elbow to the arm, and we'll stimulate a short muscle also. So we can find out whether the injury is over here, whether the injury has occurred over here, or whether the nerve has pulled anywhere else, and this is responding normal, the longer muscle, but the shorter muscle is not responding normal. So to find out the point of injury, we are stimulating one long muscle and one short muscle per nerve. So this you have to remember, that you are going to stimulate one long muscle and one short muscle per nerve whenever you are going for strength duration curve. The third thing is you have to make a table, right, for measurement. Okay, so what we are going to do over here is we are going to make this table, and we are going to keep muscles. For example, your triceps you are measuring. So this is the duration: 300, 100, 30, 10, 3, 1. And here we will write the intensities: 26 or it can be 30 or 32 or 34 or 45 or 65, right? So you have to make a tabulated form and then put it in the chart form. Okay, so you will measure the data, keep this in record, and then you will go for the measure form. Now how often you should do SDC? Frequency should be 1 per week. Okay, the SDC frequency should be 1 per week, because every week when you take SD curve, you will see the improvement in this data. that will show whether the nerve is recovering or whether it is not recovering. Okay, so this is how it is going to give you an idea of the recovery of nerve. And secondly, you can even have evidence with you that the stimulation intensities are reducing as the weeks are progressing. If the intensities are reducing, that means that the nerve is recovering. If the intensities are not reducing, that means the nerve is not recovering and it needs further testing. So beyond this, there is something known as nerve conduction velocity studies, right? Or if the muscle is not responding, then you go for EMG and CV studies beyond this point. So this is the 4 things you have to remember when you are doing a SD curve, right? So number 1, start with 300 millisecond intermittent galvanic stimulation. Number 2, long and short muscle in nerve. Number 3, tabulate the function. Number 4, graph weekly. Okay, and with this you can continue stimulating the nerve and muscle, and it will help in rehabilitation also, and this will help in maintaining a graph also, that what is the improvement or what is the level of improvement that you can see in the patient, right? If the patient shows improvement, we have to continue with the treatment. If the patient is not showing improvement, then we have to go for further testing, that is NCV and EMG testing, which will be covered as a part of your physical and functional diagnosis, right? So beyond this point, we go to EMG or NCV testing to find out a deeper level or a more qualitative level of performance. So functionally, in our clinics, you can go for this and we can start stimulation on the basis of this criteria. Now, this was how do we find out the amount. So with this we have known that the nerve is the muscle is denervated, innervated or partially innervated. So now we are going to start with the treatment protocol, right? So because we have to maintain the properties of muscle first while the degeneration is going on. So the first thing we are going to do is we are going to use the minimum current. So we will start with the longest duration, right? So always we will start stimulation with the longest duration because of 2 things. Number 1, patient adaptation. The patient should get adapted to the treatment and the treatment procedure. If the patient is not getting adapted to the treatment or treatment procedure, he will not cooperate, and if the patient is not going to cooperate, we are not going to continue with the treatment with this, right? Now second thing over here is we are going to give a low intensity, so that is comfortable, right? The lower the intensity, it is more comfortable for the patient to tolerate, so the patient's resistance will get lower in this. So we'll start with treatment with maximum pulse duration, right? So we are going to start with IG with 300 milliseconds. Gradually you will lower the pulse duration from 300 to 100, then 30, then 10. Okay, and along with that we'll keep on doing the FG test. So as soon as it starts responding to Faradic stimulation, we are going to start with Faradic stimulation also, right? So this is the way how we are going to progress. Now this can be seen with the SD curve that you are taking regularly. The intensities in SD curves tend to reduce, right? So you know that the innervation is taking place and the muscle has started responding. So implication of this in muscle re-education, right? So grade 0 to 1, we are going to give IG with 300 millisecond pulse duration, right? As the grade increases 1 to 2, again we are going to continue with IG with 300 or 100 milliseconds again, right, till the intensities get down. As the patient gets flicker of contraction, right, and he progresses towards elimination of gravity movement, grade 2 to 3, we are going to go for IG plus surge Faradic with voluntary contraction, right? As the patient progresses from grade 2 to grade 3 of muscle power, we are going to go for IG plus SF with voluntary contraction, and the same will be continued if the patient goes for grade 3 plus, right? Then if the patient goes grade 3 plus, there is no implication of neuromuscular electrical stimulation, because already the patient has got the power or strength to lift the hand against gravity, full range of motion. If the patient is lifting it 3 or 3 plus against gravity with full movement, then you do not give electrical stimulation, you stop electrical stimulation, you switch the patient to exercises, right? So this is how you are going to plan the treatment, diagnose the level of treatment, and you are going to progress the treatment whenever we are concerned with electrical stimulation. Okay, I hope the concepts are little bit clear. I'll discuss about the parameters and how to set the, and what are the parameters and what is the frequency of stimulation that is given, etc. in the next lecture. I hope you got an idea of what and how you should progress with the treatment when we are talking about treatment with neuromuscular electrical stimulation. So in the next class, we'll see the different local stimulations uses, what are their implications, what are their uses, and what is the frequency or the prescription of current that is to be given. Right? So till then, take care. Bye bye.